from the medical point of view, smoking itself, it is carcinogenic, and it is one of the cause of cancer chest. And there are many studies all over the world indicate that the rate of cancer in non-smoker is less than in a smoker. And sometimes I heard from a student or from teenager that the shisha is less dangerous than smoker because it's not available all the time. But in fact, it is more dangerous, and it can transmit all the chest disease, and sometimes one of the cause of cancer lip is the shisha smoking. And my advice from the start, we should avoid smoking, or if you one of any one of the student or the youth start to smoking, you try to how to quit smoking, because usually at least 80% of smoker at end they use drug.
Okay, actually smoking is usually the gateway to addiction. So smokers, they would go through, a person would first start smoking and then afterwards would go to soft drugs like cannabis, and then this might lead him or her to try the hard drugs or the hard stuff like coke and so on. But it's not the other way around, which means a smoker doesn't have to go through all that or all these steps. But an addict or somebody who's using hard drugs would usually have gone through these steps. For shisha, research is not adequate to talk about this freely, but from observation you will find that again it's common within the young generation. Also it started becoming more common with the female category. I personally I don't have any reason except that it's a trend and it's like a fashion to start with. It's like maybe I think it become maybe it's remotely related, but I think personally it come hand in hand with the freedom woman starts to see. It's like I'm sitting there and I'm holding a shisha, I'm telling you I'm like you, I'm a male, I'm like you, there's no difference. And I'm sitting in a coffee shop and I'm holding a shisha too, and I'm smoking a shisha too, with everything. With respect to here, the mentoring unit, of course, to maintain confidentiality, I won't be talking about students, but yes, we do experience some students who are on drugs or trying to quit from drugs. Some of them are in the phase of they're happy with it, they're still thinking that they're doing it recreationally, and they say that they smoke the soft drugs or the soft kind of drugs. Those kind of people, those that are, you cannot really say that they're addicts or not, but I think in order to define person to be an addict, it has to do with his or her ability to quit at any point in time and not be dependent, and I'm talking about the psychological dependence, not the physical dependence of the drug, although they can be quite misleading or quite not clear to the person. But as a general experience for myself, I think it does significantly affect concentration. They're not able to focus on their studies, especially when they're studying on their own at home. There's a false conception that cannabis, especially, it makes them high and makes them able to concentrate, but this is only for a very short while and then they lose concentration again. But that's only my own observation, so I can't claim that this is true for everybody or it's a research finding.